Good afternoon. Welcome to the daily briefing at the St. Clair County EMA office, where we'll bring you the latest in our COVID numbers. I'm joined with Chairman Mark Kern today, along with Brian Whitaker, the Assistant Director of EMA. We decided to give Sam a day off today, and we hope she's enjoying it, because we'll probably have a busy week next week. Brian, why don't you start off with the numbers?
Okay. So tested today, we have 35,551 that have been tested. Today, that's an increase of 661 since yesterday, with 3,862 positives. That is 70 new cases, males and females under the age of 1 through their 80s. Today's positivity rate for St. Clair County is 10.6%. Negative tests, we have 31,689. Unfortunately, we do have some sad news to report. We're adding 2 additional deaths today, bringing our total to 154. The deaths were a male in his 70s with unknown health conditions and a female in her 40s who did have underlying health conditions. For those that have completed their IDPH 14-day quarantine, we are at 2,824. For state totals today, they have tested 2,739,377. Positive are 180,476, which is an increase of 1,639 from yesterday. Sadly, the state also reported 8 additional deaths today, bringing the state total to 7,503. For hospitalization numbers and those that are currently hospitalized in St. Clair County hospitals, we have 50 patients admitted for COVID-19 related illness. 0 of those patients are on ventilators. For our congregate living facilities, and again, we're only going to announce the changes that we've had since yesterday. For Help at Home in Belleville, they added 4 new cases and unfortunately 1 new death. And St. Paul's Home in Belleville also added 1 additional case. That is the report. We'll turn it back to Chairman Kern and Herb.
Thank you, Brian. Herb, that's the biggest increase in hospitalizations that we've had since all this began.
14.
14.
And that's not good. So that's another number that we watch, but now we got to watch it closer. I mentioned to you that I got that text message from one of the local physicians the other night saying that they were seeing more patients in the ER that at that time wasn't requiring hospitalization, but they were seeing more of a volume there. But now it looks like that's even switching a little bit. So, yeah, up 14 from yesterday. So the good news is not on a vent, but as we've heard from our medical experts, that could change overnight.
Well, we've been talking with the schools all week long and finding out their program for opening up in the fall. But today, I think we've got a really informative, wonderful guest to be on this program. Shelley Lee is joining us today, and Shelley has or had COVID. She's still suffering with a lot of the symptoms, and this has impacted her entire family. Shelley, welcome to the program today. Thank you for being here.
Thank you very much for having me. I appreciate it.
So, Shelley, let's dive into this. When did COVID enter your life or your family's life?
Well, unknowingly, it entered. We have 3 children. My husband and I do, and our oldest is going to be a senior at Missouri State this year. And my husband and I and our daughter drove to Springfield, Missouri to move her from one apartment to another. And a lot of cleaning solutions, bleach, Clorox, and all that. So when she started not feeling well coming home on the 13th, she had a headache and just kept telling us, and she laid down the back seat of our vehicle and just said she didn't feel well. And we just assumed that it was because of all the chemicals and that she actually had to clean, honestly. But so she was down probably for about 4 days, just not feeling well at all. Slept a lot, didn't feel well. Still, we really didn't think that's what it was at all. She's 21. You hear these stories that, that age group isn't getting it. If they do, they're not contagious, all that. And we kind of fed into that. But it wasn't until on Friday the 17th that my husband started with a cough and a fever. that we started thinking, uh-oh, this might be what it is. And we actually had our son's graduation party scheduled the next day on the 18th. And fortunately, we made the decision to cancel that. And we all went that day on the 18th. All 5 of us went to get tested at Jackie Joyner Kersey. So that's kind of when it all started. I would say the 13th.
And so when you all got tested, what were the results that came back? Were there any surprises?
Yeah. I mean, when you get that call that you test positive, even though at that point, I still wasn't having symptoms. So my husband, when he started coughing and the fever and the fatigue and exhaustion on the 17th, he pretty much Friday, I would say all day Saturday, Sunday, Monday, he didn't do a whole lot, didn't feel like even getting out of bed, missed work on that Monday. So we got tested on Saturday the 18th, and the health department started calling us individually. All 5 of us got a phone call that Tuesday the 21st, and he got the first call that he was positive, and he actually called me. We both work from home, fortunately. He called me from the basement and said, hey, they just said I'm positive. So at that point, we just thought, well, he's going to stay in the basement. You know, if the rest of us, I assumed with the rest of us were negative, and we would kind of figure out where to keep him in the house. And then my call came in that I was positive. Our 21-year-old was positive, and our 18-year-old and 16-year-old were negative. So we were like, well, what the heck do we do? And so the thought was try to keep our 16 and 18-year-olds separate from the rest of us, and that didn't last very long. The health department has been invaluable. I actually feel like Trish with the health department has become a friend. I've talked to her so much. So the shocking part of that was, so we've been told that we need to isolate those that tested positive. You isolate for 10 days from the onset of your symptoms or the date that you test positive, 10 days. After the 10th day, as long as you're fever-free with no medication to help with the fever, you are released and you are no longer contagious. But what that means for our 2 children that test negative, they not only have to quarantine our 10 days, but then they have to tack on an additional 14 days because they could at some point become contagious, become positive. So that was really shocking, and there were some tears and, a lot of guilt on my part that my 2 kids that tested negative had to lock down for even longer than, more than double for those that tested positive.
But you shouldn't feel guilt because you canceled a graduation party that might have led to a much bigger spread of the virus in this
Yeah,
county.
I tell you, that was a really hard decision. Even though I knew my husband and I knew we had to do it. But, these poor seniors this year, they've just missed out on everything. And I just wanted to celebrate him. I'm about ready to cry. Sorry. So
Okay, you're
that was just really hard to start contacting people. But I tell you what, when they called that Tuesday, the 21st, and said we were positive, and Trish started asking each one of us individually who we had been in, God, I'm a baby, I'm sorry, who we had been in contact with 48 hours prior to our symptoms starting. For me, because my symptoms actually started the day, I had a headache on the 19th. I just kind of a mild headache. So that's probably when my symptoms started. But the day they called us on the 21st with our results is when my cough started. So for me, I hadn't been around anyone. I mean, once John started coughing on the 17th, the 5 of us did not go anywhere. But we had to notify some people. Sorry.
Don't be sorry.
We had to notify people that John had been around for 48 hours and our 21-year-old. So had we had to call all those people that were planning to come to the graduation party, that would have been horrible, especially if we would have had that party and we had symptoms and just didn't tell people. I mean, oh my gosh, the guilt would have been terrible. So as bad as I felt for my son, and I really had a pretty miserable weekend, that was the one thing I was so thankful of, that my parents weren't here, my My in-laws weren't here. Yeah, we made the right decision, even though it was a tough one.
And so people understand you're not a family of underlying health conditions. Your husband's actually a marathon runner.
He is, yeah. He's run 10 marathons. He long distance runs all the time. Everybody in the neighborhood in Maryville sees him running out with our dog all the time, and it it has really, that's what we've talked about, how it's really affected our lungs. He did try to go out on a 3-mile run the other day, which should have been really easy for him, and he just really felt like he had overdone it, and it knocked him out for a couple days. He mowed the grass last Saturday, and we don't have that big a yard, and halfway through it, he came in and he's like, I got to take a rest before I finish. And the fatigue has just been, I mean, I actually officially got the call Thursday that my quarantine is up, but as you can tell, I'm still having symptoms. The cough has been real persistent for me. I lost complete smell and taste. I'm the only one in the family that actually lost my smell and taste, which is very bizarre and horrible. I like food.
And so that means when you're putting something in a cupcake in your mouth, it doesn't taste like anything.
Nothing. Yeah. It was just really bizarre because you're still hungry. You know, my stomach would still be growling and I still felt like I wanted to eat something. So I would just eat things that I knew would kind of fill me up, like oatmeal and cereal, and but I didn't taste anything. And my team at work, they were very sweet, and they sent a huge box of everything Bundt cakes, 12 different flavors. My family went on and on and on about how delicious they were. I couldn't taste any of them. They all tasted like nothing to me, but I ate some because there wasn't going to be any left for me if I didn't. But we ordered pizza one night, and it literally tasted like I was eating cardboard. My taste is coming back. I noticed 2 nights ago my daughter made brownies, and I actually could start to taste a little bit of sweet and a little bit of salt. Things definitely taste different. I still don't have smell. So that's very bizarre. Now, my husband didn't lose taste or smell, but it definitely changed because he's a coffee drinker. He roasts and grinds coffee beans, and he says coffee tastes like crap to him. So it's definitely affected his taste, but I lost it completely. I couldn't smell. One night my daughter said, I was trying to cook spaghetti, and she said it smells like it's burning. I would have had absolutely no clue.
Wow. So they're really, your doctor couldn't prescribe any medication, over-the-counter things? Is what
we called. So our son started exhibiting symptoms last Friday, which would have been, oh gosh, I thought I wrote it down, the 24th. Now, he's the one that tested negative. So when he started on the 24th, of course, that was another horrible thing because that meant our 16-year-old, Lauren, her 10 days started all over again with Garrett plus 14, which puts her up to August 17th, day before school starts. He had an earache, pretty much slept for about 3 or 4 days. He had a lot of stomach issues, which we did not really have that. So we were told by Trish at the health department that we had to treat it because he exhibited more than 2 symptoms, that he was also now positive. We did take him this week to get tested again along with our 16-year-old, and they both came back negative. So I don't know. I mean, he's not felt well for a week. We did call our family doctor because I was worried about his earache. They said that because it's a virus, there's really nothing we can give him other than vitamin C. We've been doing a lot of vitamin C, NyQuil to help with sleep, heat pad for his ear, and Tylenol. They recommended like Tylenol extra strength for headaches and stuff. But so I don't know.
So this has to really play with your mental health, I would think. And so did you have a lot of nights where you were scared about your lungs filling up or having a hard time breathing?
Yeah, I would say my worst night was actually just this past Thursday, and I could just feel the pressure on my chest. And I still don't feel like I can breathe in very far, like my breathing is much shallower. If I do take a deep breath, I cough. Thursday night was probably the night where, because I have a good friend who actually drove herself to the emergency room last Friday, and they admitted her with pneumonia, who has COVID. And I've been talking to her every day, and I thought, oh God, here we go. And yeah, I had a pretty rough night Thursday, and I do feel like it's a little bit better, but that's probably my worst.
So because you are extremely nice person, you've been on Facebook kind of helping people who may have questions because you're maybe a couple weeks ahead of where they are. Did you get a lot of response from your Facebook post? And what were some of the questions that people would ask you that were suffering from COVID?
Yeah, I finally had, I went back and forth for about a week on should I post anything or not. First of all, I didn't feel like it. Like, I just didn't feel good. I didn't even have the energy. It was almost like fog brain. Like, I would literally be in the middle of a sentence and completely lose track of what I was talking about and stand there with the blank stare on my face and couldn't remember what I was even saying. And I remember when I was pregnant kind of having pregnancy brain, and it felt like that, where I couldn't form thoughts. I was just exhausted. But there was just one night that I thought, and it actually, the reason I decided to post it is because my 16-year-old is a volleyball player for the Collinsville volleyball team, and one of the girls on the team, she had not been going to practice because of what we were going through, and one of the girls on the team had tested positive, no symptoms, but they completely shut down the volleyball practices, and the whole volleyball team was told they couldn't come onto campus for registration for 14 days. And so I called that mom, because she's a friend of mine, and I just shared with her what we'd been going through, and she's like, my God, I had no idea. And she just started asking me all these questions. What does this mean for our family? What if she does start getting symptoms? And I just thought, I know there's got to be other people out there going through this, because I just felt very alone. I mean, I felt so alone. And so I finally decided one night, and I kind of just typed up, it was really lengthy, and I just kind of went through the whole timeline, kind of what I'm sharing with you, and the tears and the guilt and the anger and the frustration. And, I've got 2 kids. My son's getting ready to go to Mizzou, and, my other daughter's going to Missouri State, and the fear for them, he's going to be in a dorm. What is that going to look like? And so I just kind of shared everything, and I could not believe the response I got. I mean, I think that initial post has been shared about 110 times. I started getting a lot of friend requests from people I didn't even know. But a lot of people started reaching out to me through Messenger and sharing their stories that they were going through what we were going through, but they hadn't told anybody. And the prayers, oh my gosh. So I just didn't feel near as alone once I finally shared it. And, a lot of people reaching out asking the main questions: how'd you get it? We don't know. I suspect our daughter, she had been in contact 5 days prior to our 21-year-old getting sick on the 13th. She had 5 days prior to that had been around 2 different people that we found out later had tested positive. Probably it came from one of them, but we don't know. No idea. That was the biggest question. A lot of questions about how long do you have to stay isolated? The big question now is, I was released as of Thursday, but I still have symptoms. I don't feel comfortable really going anywhere still. I don't think people would be comfortable being around me. Another big reason I shared, not only because I found out there were other people going through this, was I was getting really, really angry at a lot of the comments and the posts people were putting on social media about that, not wearing masks. I mean, that's a big one, and I tried like heck not to not to go off. And, and then when people who are friends of mine, commenting on there that this is all a hoax and it's political, and I'm like, I'm sitting here, my whole family, what I felt at the time had just been wiped out, our whole life. Like, fortunately, my husband and I work from home, so it didn't affect our jobs. And our bosses were very understanding if we needed to take time off. Sorry, to rest. But if we didn't, if we had to go into an office, sorry, my train of thought right now. I still do have fog brain.
No, you're doing fine. And you were saying that
boss.
people don't believe. People didn't believe you.
There were so many people, and people that we knew that didn't know we were going through this. And so when I shared that, some of those people reached out to say, I'm so sorry. Like, I'm so sorry you guys are going through this, and what can we do? And I just kind of wanted to educate people that I really don't care what your beliefs are. I mean, I really don't, but just be conscious of the fact that there are families like ours out there that have been devastated by this and scared. And it's just been a really emotional, isolating time. So I was more sharing to say, just be kind, just be conscious that what you're putting out there, that might be your belief, but there's others actually affected by this. And, and at the beginning, I kind of felt that way too. I mean, we didn't know anyone that had it. And so when we were diagnosed, I was like, holy crap, you got to be kidding me. Like, us? Why us? So we know an awful lot of people now that have gone through this.
Well, Shelley, you're a real hero for coming out and talking about this today. Herb?
Well, Shelley, that post that you wrote that first night, and I must admit I was one that had viewed that, and that's why I reached out to you, because as I told you, for many, many days now, it seems like forever, we've been doing these briefings, and when I read your post, I could just feel the hurt you had, the anger. I could read that in your post. And I'm so thankful. But, I got to applaud you. You and your husband canceling, as the Chairman Kern said, canceling that graduation party. And I know you feel bad about that, but you shouldn't, because you actually did the right thing, and you saved some other people from experiencing what you're experiencing right now. And you and I talked. I get to be the voiceful one here. I've been trying to share that word about this virus is our invisible enemy, and it's everywhere, and you are a proven fact of that. And there's a lot more people out there that are experiencing what you and your family have done or been through. And I mean, it's terrible. I'm glad you're feeling better. You don't sound a lot better from when I first talked to you.
I actually sound a lot better.
Do you? Okay. The cough sounds terrible. Your husband, I hope he gets back. I know as you read things and all the news media and people being on ventilators, I know that was a thought going through your mind. Is one of your family members going to have to do that? And just thank God that hasn't had to happen to you, but it is happening to other families out there. So I applaud you, as the chairman said, for coming out and sharing your story. And maybe some of these naysayers, as I call them, will understand that it's not about politics. It's not about where you live. It's not about your religion beliefs. It's real. It's serious. And you're a proven fact of that.
Yep.
We really thank you.
Chair, thank you.
Thank you.
Thank you very much. We
Thanks for
appreciate
being
it.
with us today very
Thanks,
much.
guys. Have a good day.
Thank you.
you.
You too. Well, that's pretty powerful, Herb. Very powerful.
Real powerful.
So we'll move into the zip code report, which is a tradition here on this program. These are the amount of COVID positives in these particular zip codes. And today we'll start with 62059, went up by 1 to 11. 62201 went up by 3 today to 184. 62203 remained the same at 151. 62204 remained the same at 115. 62205 went up by 1 to 147. 62206 went up by 3 to 337. 62207 went up by 2 to 201. 62208 went up by 7 to 245. 62220 went up by 17 today to 319. 62221 went up by 5 to 339. 62223 went up by 3 to 168. 62225 remained the same at 16. 62226 went up by 9 to 404. 62232 remained the same at 83. 62239 went up by 2 to 46. 62240 remained the same at 14. 62243 remained the same at 26. 62254 went up by 1 to 119. 62255 remained the same at 13. 62257 went up by 2 to 22. 62258 went up by 1 to 59. 62260 went up by 1 to 45. 62264 went up by 2 to 68. 62269 went up by 12 today to 271. And 62285 went up by 3 to 37. A lot of increases today. Numbers not going in the right direction, Herb.
No, and when you look at the numbers that Brian read today on our tests from yesterday, the age limit's under 1 to 80. So I don't want to hear, and Shelley mentioned it, she was one of the ones that thought, oh, it's only affecting the older people. Now it's in under 1 years of age. So you people out there got to start listening to what we're telling you. 14 new hospitalizations overnight. That could double, that could triple if we don't start doing what we're supposed to be doing. We talked about it yesterday. I got a little chastised from some people because I mentioned the business people need to be more responsible. That's my belief. I think that if I was running a business and I was concerned about my customers, I would want them to be safe. It's nothing against the business owners. It's about them being responsible. They should require their employees, they should require their customers, because it's a two-way street. We've heard those medical experts say that mask protects both of you. If both of you's got it on, you got double protection. Is it 100%? We've heard them say that also. No, it's not. But I'd sooner have a little bit of protection right here than not have any at all.
And that's a lot of protection.
That's a lot of protection.
If both parties are wearing masks, the chances are much, much less that you're going to get COVID when both parties are wearing those masks, when both parties are washing their hands, and when both parties are watching their social distance.
Social distancing, we're working on that, and we're going to be reporting more on that in the next few days because we get calls here at the EMA office every day about different businesses that aren't, they're allowing a lot of people in and they're not following that. So we're going to be reporting on that a little bit more. But, I said here a few days back, if you sit and add up the amount of time you have to wear a mask unless it's required by your job, but if you're at home and you got to run to the store, you put it on. I bet you it's not an hour, 2 hours out of the day that you got to wear a mask, the average person. So it's not comfortable sometimes, but you got to do it if we want to get through this. And I want to go back to Shelley. I mean, if that doesn't tug at what we're trying to do here, and to think there's many, many more people out there what she's going through.
And she's still coughing. I mean, that is a tremendous cough that she's still living with every day, and it doesn't sound like it's going to be going away very soon.
Exactly, and so I'm thankful that she came on and told her story. I wanted to also mention one of our Team St. Clair members, Sue Clark, has got a family friend that's in the long-term healthcare facility that was just diagnosed. I want to give our shout out to her and hope that everything turns out there. Sue follows all these briefings and helps share and get this message out. So, Sue, our thoughts and prayers are with your family friend, and hopefully she'll do okay, and we appreciate that.
And the reason that you're talking to the business community is because, again, today we're at 7.7 with our regional positivity. If we get 3 days of 8%, and we're pretty close to that, then the state will, we're going to take a step backwards. We're going to head closer to that phase 3 level where we were. So we're trying to say that
Yeah.
your fate is in your hands.
Right, and that's what we've told our community leaders. If everybody just does a little bit more for a little while longer, we will get through this. We'll get behind this. And but again, it's going to take everybody. And that's why I applaud all of Team St. Clair for all of you that follow these briefings every day and share. And we're picking up more and more people every day. So I can't thank you enough, Chairman Kern. I know him and I talk about it all the time. He reads those comments that the users are putting on there. And we appreciate getting the word out there. We appreciate Randy Pierce, who writes the articles in the paper supporting what we're doing. The news media that picks up on our feed. That's how we have to get the word out there. And we're still going to have people that says it's a hoax. You heard Shelley. At first they thought, never going to happen. And then you get that phone call one day and look out. And that could happen to any of us. So if you don't want it to happen to you, wear a mask, wash your hands, and watch social distancing. Simple, the 3 W's. We'll be back in just a few moments with Cindy to translate this into our Spanish communities, and we'll be back here tomorrow afternoon for our question and answer session, 3:30 tomorrow afternoon. Have a good evening.